Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Dementia. So under dementia, we'll also be looking at the assessment and the treatment. So first, what is dementia? This as per the DSM-5, the dementia and amnestic disorders, they are added to the new entity called the major neurocognitive disorders. So major neurocognitive disorder, they are added to the major neurocognitive disorders. So as per the DSM-5, so DSM-5 is a significant cognitive decline. So there is a significant cognitive. So significant cognitive decline is seen, and this is seen in one or more cognitive domains. In one or more cognitive domains. So they are seen in one or more cognitive domains, that is, it is concerned about the significant decline expressed by the individual or reliable informant and substantial impairment. So there is also substantial impairment, and this is documented by the objective cognitive assessment. And interference, there is interference with independence with everyday activities. Now the strongest risk factor here is the increase in the age, the strongest risk factor. Now the global deterioration or the high mental functions. So what is a global deterioration? So global deterioration of the high mental functions. Impairment includes the recent memory. You have the recent memory, or in early stages the short and the remote memory, and that is a late stages. You have the short and the remote memory. Now the deterioration of the personality, and with the lack of personal care, you have lack of personal care, and there is impairment of impaired judgment. So impaired judgment and reasoning as well. So impaired judgment and reasoning, speech as well, difficulty finding right word, aphasia, and also presence of the mutism, and thinking of slow and muddled. So thinking of slow as well as muddled, delusions and no sight, and all about the features interferes with the daily living skills. Now the Montreal Cognitive Assessment, there is a mini assessment. So you have the two assessments. So let's look at these assessments. So under assessments, there is a mini mental state examination. So mini mental state examination, you have something known as a screening tool. The screening tool and a score. You have a screening tool as well as a score of less than 24 out of 30. A score of less than 24 out of a total of 30 is suggested to have nothing but the dementia. Now it includes the test of, there is orientation. So orientation comprises of the 10 marks. Orientation is 10 marks, which includes the identification of a year, and then comes a day, then comes a month, as well as then comes a country. Then comes registration. The registration it comprises of 3 marks. Then we have the recall. The recall in this is the patient is asked to remember the same 3 objects. So same 3 objects are told to remember that were shown 5 minutes earlier. And it comprises of 3 marks. Then comes the concentration. Concentration it comprises of 5 marks. Then comes the presence of the language. Language is considered as a test of the executive, the test for the executive functions, and this comprises of the 9 marks. Then comes the treatment. The treatment is the drugs such as the donepezil. Donepezil is used. Then comes the rivastigmine. Donepezil, rivastigmine, then the galantamine. So donepezil, rivastigmine, galantamine, and the memantine. So all these are used. Some of the newer drugs includes the aducanumab. So aducanumab is used for the dementia. So earlier we saw the donepezil, rivastigmine, galantamine, as well as the memantine is used. Now the newer drugs, it includes the aducanumab as well as the lecanemab. There is a lecanemab. Now for behavioral and the psychological symptoms, we have behavioral and the psychological symptoms. So behavioral and psychological symptoms, it includes the antidepressants. So antidepressants as well as presence of the antipsychotics. It may be used. To learn and grow daily like this, please do subscribe.